Founder of healthcare facility Clinimed, Dr. Matubela Machikane, started a campaign to create content and videos around the virus in as many of the country's official languages. This was to ensure that everyone gets essential information about the coronavirus. The videos have been uploaded on social media platforms where people can access information about COVID-19 in their own language. A COVID-19 survivor herself, a gap was identified to be made to ensure that sufficient information is at the disposal of everyone. To tell us more about the campaign, we are joined by the doctor herself, Dr. Matubela Machikane. A very good morning and welcome to Morning Live.
Good morning. Thank you for having me.
Can you tell us
Yes,
Go ahead.
Go ahead. Okay, just to tell you a bit about the campaign. Basically, the campaign was to educate the public about the disease and about the importance of protecting themselves and how the disease was spreading. And we started the campaign with the first wave. And at that time, the numbers were very low and the numbers were very low and we were still under a very strict lockdown. So a lot of people needed information to know how to protect themselves and how to make sure that they are protecting their loved ones.
Why is it so important that you do provide this information in the different languages, the different official languages in South Africa?
One thing that we had realized was that with the pandemic that had erupted, there was a lot of medical jargon that we needed to break down. Simple things that people would take for granted, like social distancing and things like wearing a mask and making sure that you're washing your hands, hygiene, all of that. So we needed to make sure that people are understanding the exact context in their own languages so that they can be able to process it better and to be able to take action into what we're trying to get the message portrayed across.
Who did you consult to put together these different videos and messages in the official languages? Because often when it comes to translating, very technical terms or terms and ideas from certain sectors, many languages, they don't necessarily have direct translations. How did you get help with regards to that?
I must say it was a challenging aspect of that because obviously we do not speak all the different languages. However, when we went on the campaign, there were a couple of South African language board platforms that approached us to try and partner with us so that they can help us translate even more into other languages, because the most languages that we were fluent in was mainly Spanish, Xhosa, and isiZulu, and yeah, I think those were the three languages that we were very fluent in, and the other languages we had to partner up with the Language Board of South Africa to try and help us translate the message into the other languages.
What's the feedback been like from the public?
I think the feedback has been very positive. We managed to get the feedback mainly from our own clients as we deal with them in the clinics. Yeah, and I think for especially the elderly, because those are the people that most of the time they are not on social platforms at times, but we try to engage their young ones to show their elderly and communicate with them and show them how everything works, and the feedback was quite positive from them.
What do you think the biggest problem has been, or the biggest challenge has been, in actually disseminating the correct information around the coronavirus?
I think the biggest challenge with disseminating information around coronavirus has been the fact that it has changed the way we as everybody lives, and everybody had to adjust faster than we thought. And the fact that this is a virus that the mortality rate is very high, and if you're not taking the correct precautions yourself or anybody around you, you stand the risk of dying. Whereas most of the diseases that we're dealing with would be like a 5-year prognosis and so forth and so forth. But with this particular virus, we're looking at anything within 20 days or within 10 days, we've lost a life. So that is the most challenging thing about it.
All right, lovely stuff. Thank you so much. That's Dr. Mathubela Machikane speaking to us about her innovative way to help disseminate essential information around the coronavirus. And she herself is a COVID-19 survivor. We thank you so much for your time here on Morning Live. And thanks for putting together such a fantastic campaign and making sure that everybody gets the information in their home language across the country.